Welcome back. It's proven that having a diverse workforce can lead to better outcomes. You'll get well-rounded voices, views, and opinions, and that's extremely important when you look at healthcare. Diagnosing, treating, and advocating for patients really comes down to decisions made by only people in the room. It's also why I found it very interesting that out of Dignity Health's 6 hospitals in our area, 4 of them are run by women that I recently had a chance to sit down with.
Lisa Hausman, Phyllis Baltz, Tina Johnson, and Gina Bravo are all hospital CEOs.
I think what you're seeing right here is a very unique situation.
They run Dignity Health hospitals in East Sacramento, Folsom, Sacramento, and Woodland.
Being a president of a hospital as an executive female is showing the possibilities to those that there is a pathway.
Trailblazing women who are disrupting the healthcare industry in the best way.
I introduce myself to patients every day and I say I'm Tina and I'm the CEO, and they are taken aback a bit.
Dr. Tina Johnson is the CEO of Dignity Health Mercy General in East Sacramento. She began her career as an ER doctor.
When I graduated in medical school, women were 25% of the graduating class, and that was the highest it had ever been at that school. Fast forward years later, and 50% of medical school graduates are women.
Her support helped create a Women's Heart Center on the Mercy General campus.
Many women delay preventative care that might make a difference for their heart and progression of heart disease.
Delaying preventative care is something Gina Bravo, Woodland Memorial Hospital's first ever female CEO, is familiar with. She was diagnosed with stage 3 breast cancer during the height of the pandemic.
That I had missed my mammograms for a couple years, not put myself first, not taking care of myself. And it made me look back that I didn't follow all the rules that I tell everybody else as a patient. I was receiving chemotherapy and radiation, I was bald, I was making it to work, and I was offered this job as CEO because somebody still trusted me to take care and to run this hospital.
For Gina, it's a job that she doesn't take for granted.
So it's going to be really important as presidents that we don't plateau women by taking these roles as personal achievements, but we understand that there's a responsibility with these roles to pave the way for the people behind us. I truly believe our role and our duty isn't these 4 walls, but it's this entire community.
Women currently make up 70% of the global healthcare workforce, but only hold 25% of the senior roles.
It's a challenge to be able to find the opportunity, be given the chance to progress your career.
Phyllis Baltz, CEO of Methodist Hospital in South Sacramento, says she's learned to be comfortable with the uncomfortable and mentor others along the way.
Especially females who are interested and see that maybe there is a pathway to an executive position down the road.
After 30 years of healthcare administration experience, she knows firsthand that
representation of females in executive positions as part of the decision-making table makes a better rounded, broader decision-making in an organization, which just only benefits the organization.
I have always reported to men my entire career. And this year, for the first time in my entire life, I report to a woman.
Lisa Hausman is also breaking barriers as the first female CEO of Mercy Hospital in Folsom. She, like her 3 colleagues, are also known as Mom.
The biggest challenge has been finding balance as a mother and as a CEO of a hospital. And there's not a magic recipe for that. You know, I was just traveling and someone asked me, who's watching the kids?
She hopes the legacy she leaves behind paves the way for her own daughter and changes societal expectations.
I think that mentality is shifting as you see women start to elevate in their careers.
And a quote that reminds her of that,
and it actually kind of gets me emotional anytime I hear it, is that while we haven't shattered the highest, hardest glass ceiling, there are about 18 million cracks in it. And that's, to me, is so important as female leaders that we continue to advocate to make sure that there is diversity at the table.
4 women breaking barriers for the next generation of healthcare leaders.